Dr. Bill Wilson from Lowcountry Orthopedics. Dr. Wilson, thanks for being with us today.
You're welcome.
Can you tell us a little bit about lumbar spinal stenosis?
Well, spinal stenosis in the lumbar spine or the lower back is a degenerative condition in which the tissues in the lower back start to degenerate or wear. The joints become arthritic. Arthritic bone spurs are formed, which narrow the spinal canal. So spinal stenosis is basically a narrowing of the spinal canal. Some of the symptoms that are associated with spinal stenosis are low back pain, which is probably the most common symptom. People will often have pain referred from the lower back into the lower legs. Numbness, tingling, trouble walking because of pain radiating down into the lower extremities is very common with spinal stenosis.
Now, once someone is diagnosed with spinal stenosis, they realize it's not lower back pain. What are some of the treatment options?
Well, initially, if you see your physician and it's diagnosed that you have spinal stenosis, anti-inflammatory medications are often very helpful. They will help relieve some of the symptoms associated with spinal stenosis. Sometimes if the symptoms are more prolonged, physical therapy is helpful. Physical therapy can help relieve some of the symptoms associated with spinal stenosis, such as the stiffness that people get when they're have this for a while. Sometimes if the symptoms become more significant, epidural injections or shots to the lower back are often helpful. People commonly refer to these as cortisone shots. It doesn't cure the spinal stenosis, but it's often very helpful in relieving the symptoms. And then some patients, the symptoms are bad enough or the spinal stenosis is bad enough that surgical intervention is required.
Now, in a situation like that where the patient does require a surgical treatment, what about the recovery time?
Well, part of it depends on how many levels are involved, how many areas in the back are involved. Typically people are in the hospital for a day or two, sometimes a little more than that if more prolonged surgery is required. But typically people's symptoms will improve very rapidly, and in a few weeks they're up and about walking, and in a few months they're back to doing some of the activities they want to do. Great.
Well, Dr. Wilson, thanks so much for sharing that information with us today. For more information, you can contact Dr. Wilson and his team at 797-5050 or log on to lowcountryortho.com.